Hi, I'm Kelly Busby with Kingwood College, and we're going to talk about oxygen therapy. This is a cannula, and this is the most common oxygen that a patient gets. This is a low-flow system. Now, to put the oxygen on, I've got a wall, and I have a flow meter. The flow meter has to be pushed into the wall fairly hard, and you have to line these bumps up, okay? See, this is vacuum. This doesn't match. This is so we don't get things confused. Now, it's in here. You notice that the ball jumped up. You notice there's no noise except bump and then it stopped. That means there's no leak. I'm going to turn it on so you can hear what the noise sounds like. Okay? Now, I'm going to put my cannula on, and I'm going to turn it to 2. And the little green thing right here is called a nipple adapter, and it's also, the nickname is a Christmas tree because it looks kind of like a little tiny Christmas tree. We move this to a 2. This is 2 liters a minute. And before I put it on my patient, I'm going to feel it against the back of my hand. Now, if I've got gloves on, I may have to move up on my arms where there's hair, and even a small flow, you can feel it. But what works even better is to turn the flow up real high, hear it, and you can actually feel it a lot easier. Then move it down to what you want. That way, if it's going to pop off, it would have popped off. Now, I'm going to put this in this way. Goes into the nose, and I usually hold it on the patient's face. And I put it over each ear, and I let go, and then I kind of lock it into place right here. This is how they wear it. Now, if the O2 goes up to 5 liters, which is over 4, I need to put a humidifier on. So I'll show you how we put the humidifier on. I take the nipple off. I'm going to go ahead and turn this off. This is humidifier. These all come in different packages. You open up the package, you get this. You open up this package, and I'm going to screw this on. Now, this adapter goes on the bottom of the flow meter, and I screw this on as far as it will go. When it's brand new, it'll pop a hole. You're not going to hear the hole pop because I've already popped it. Then I set this on the end, the outlet of the flow meter. This is the inlet of the humidifier and outlet of the flow meter. Now, I'm going to turn it on, and you're going to hear there's going to be some problems. See how that's swelling up? The reason why it's swelling up is because I forgot to detach this. Now, it needs to have a hole punched in the top, and this hole needs to be detached. The oxygen is going to go through the water and bubble out. So again, we'll move it to 5 liters. Now, the nice thing about a humidifier, I can see and hear the bubbles going through. I put my cannula on, test it, make sure we still have flow. I can feel the flow. And again, I just put it on my patient this way. Nose, ears, tighten it up, and there we have it with a humidifier. Now, let's say my patient's ears are breaking down. What I can do is put these little cushions on, and they're nice soft plastic that fits over the ears. So it would go over the ears. You have to kind of move it to make it fit where their skin's breaking down, and you can put it over the ears, and it's a little less comfortable, a little more comfortable. Now, if there's a real problem, sometimes we actually have to tape the cannula on their face. Some people, they'll really get broken down until that heals up. Let the nurses know about it because they need to get antibiotic or whatever kind of cream the doctor orders. Okay, so this is a cannula. Right. Now we're going to show you. Now I'm going to show you the Vini mask. Now, the Vini mask mixes oxygen. These are this is where the oxygen comes in. This is where the air is entrained. And the higher the FiO2, the smaller the window. See how tiny the window got? Because that's 50%. I move it up. This is 35%. If I need a real low oxygen, I have to move to the green door. And I don't have a green door on me, but I would take this whole piece off and replace it with a green door, and then we would be making our oxygen choices on that end. Now, when this goes on, it needs to be locked in, and you need to make sure that the point is actually pointing to a line, and it says 35%, and it says run it at 9 liters. With oxygen, a lot of times all you have to do is read the directions. It says 9 liters. Now, I'm going to cover this with a lock-on piece so the patient can't accidentally turn the oxygen off or disassemble it. And then I'm going to put this little piece here. Now this piece protects, if the patient's bed sheet, they get this mask under the bed sheet, it keeps the sheets from getting in the way of the door. Otherwise it would mess up the oxygen entrainment. Now I put the O2 line on just like I did last time. Now, this humidifier may not be able to run this because we may have some pressure backup. Watch the flow, and if the flow stays at 9, it's okay. But if the flow drops down, we need to take the humidifier off and run this on a nipple. Now, to put a mask on a patient's face, you put the mask over the face, and then you just pull this across the back of their head, and then tighten it down a little bit here, and that's how the mask fits. Now we're going to put a simple mask together, and a simple mask has nothing fancy on it. It's just the mask. It's got small holes. These holes are real big. These holes are tiny. Turn the flow up. Let's say the doctor ordered 10 liters on a simple mask. Always put your flow on before you put it on the patient's face. Now, I'm feeling the flow go out. Now, if you have gloves on, you may not be able to feel it with your fingers. You may have to take your gloves off to feel that. But I can feel this. Sometimes you can hear it. It's coming out here, but you do need to make sure you can at least hear it coming out here. And I should have done that with this one, but this was pretty obvious because it was kind of loud. Again, this goes over the face, pinches slightly to fit, and the patient's wearing the simple mask. Now, the last mask I have is a none-rebreather. Now, I know this is a none-rebreather because it has the valve in the middle and it has the valve on the side. We never have a valve on the other end because just in case we lose oxygen, we don't want the patient suffocating. Yes, you can get them, but the company won't even sell them unless the doctor specifically orders it, and it's a one-time deal because that's fairly dangerous. So we're going to put the same humidifier is going to go to this. Now, before I put it on the patient, I put my hand over this if I have to let this bag fill up. Never put it on the patient's face without the bag being full. That's not enough flow. You always want to have the bag a little bit inflated when they go to take a breath. Okay, this is the end of introduction to oxygen. Go ahead and turn it off now.